expecting the hey
everybody. That's how I usually start them off. It's St. Patrick's Day. We had green juice in the office this morning, which was great. Green juice from Clean Juice.
Green juice from Clean Juice.
Hashtag green juice from
We're
Clean
wearing
Juice.
our green.
We got green on. We got Mardi Gras beads on.
We're taking shots of green juice.
What else did we do? You did a scavenger hunt with the kids today.
Yeah,
with the
they
twins
loved
today.
it.
Find the treasure.
Find the treasure.
The leprechaun's
The end of the rainbow.
Yeah, that's what we've been doing. And now it's time for Wellness Wednesday. So
we're here.
Today we're talking about infant reflux and Gerd that we've seen.
Yeah, we see a lot of it right now.
Yeah. We've had a lot of parents calling in, bringing their kiddos in and stuff for reflux, spitting up, throwing up, all that kind of stuff. So we just wanted to talk a little bit about that.
Like why they would see a chiropractor for it.
Yeah. And also like...
It's usually last result. Usually they've tried all the other things.
Oh my gosh, yeah, we see all the these kiddos that are being put on like adult Gerd medications and antacids and stuff like that. So that's kind of wild to us.
Yeah.
We wish that we would be higher in the hierarchy, but that's why we do these videos, to educate so that people know that chiropractic can help with those things and help their body naturally process things so we don't necessarily need the medication and stuff. So
why do we think we're seeing so much of it?
Stress.
Always back to stress.
Always back to stress. These COVID babies.
I mean, COVID babies.
Yeah, stressful pregnancies, stressful births, upper cervical misalignments.
Yeah, and probably like upper thoracic.
Upper thoracics, yeah. So in these kiddos, we typically see a lot of like the similar signs of like torticollis, favoring one side, not latching well, all that kind of stuff. So
angry on their back, angry on their bellies.
Angry on their bellies, yeah, for sure.
Yeah,
pushing back, we see if they're on their backs, and then when they're on their bellies, they just...
Which tells us like dural tension.
Yep, exactly.
Which is in your spine.
That's usually comes from C1, so the very top bone of the spine. C1 is also your vagus nerve, exits the cranial... it's a cranial nerve, so it exits the cranium right in front of there. And so if C1 is subluxated, it's going to affect how vagus nerve is functioning and how that's communicating, and also how baby's digesting, how they're doing all of their autonomic activity, really. So digesting, heart rate, sleeping,
breathing,
all the normal things that baby should be doing. I feel
vagus
like
nerve is a big nerve. We need to get like a picture diagram to show them next time. Vagus nerve. Vagus how it goes all the way down. Yeah. Supplies all that GI stuff. So so if it's messed up on top, it's going to mess up everything all the way down, usually.
What happens in Vegas?
Yeah, what happens in Vegas.
Happens in the whole body.
Happens in the whole body. Doesn't stay in Vegas. No. Goes everywhere else.
Goes everywhere.
Yeah, so it's usually like I had a mom call recently, new patient about her kiddo, like, oh, it has acid reflux, it's really bad, it's 5-month-old. I don't want to do the drugs, I'm trying this, can chiropractic help? I was like, tell me your birth story. And traumatic birth, lots of pushing, stuck in the pelvis, and I was like, probably, sounds like birth trauma, also sounds neurological.
Pregnancy is stressful. They move during the pregnancy, so.
And it's like, okay, I think chiropractic can help, because it doesn't necessarily sound like an allergy to me.
It doesn't sound like it's a stomach acid issue.
Yeah.
No. It sounds like it's
a structural issue, a neurological issue.
This baby is deficient in antacids, that's what's going on.
Sounds like yes, because of like what happened. This does sound like chiropractic care can help. Granted, are there kids who have bad allergies or spitting up? Yes.
Yeah.
Chiropractic care still can help us with allergies.
In fact, allergies are still a product of a dysfunctional nervous system.
Yes. So it can help calm down some allergies also. Yeah. Yes. Yes, chiropractic care it's just gonna help your body function better.
Yeah.
So when baby's feeling better, when baby isn't spitting up all the time, when baby's sleeping, when baby's more comfortable, guess what? Mom and dad are happier also. Exactly. They're sleeping better. They're not so stressed out. They're not. So it's like hard to like think about feeding your baby when you're like, okay, I gotta sit them up for like 10 minutes afterwards, and then they still might spit up, and I gotta make sure I bring like 18 extra pairs of clothes wherever I go because they're gonna puke all over them. And
we need to make sure they're getting enough food because they're not gaining enough weight. They're cranky. All that kind of stuff. It's stressful.
So we see great results in our office with acid reflux.
Yeah, so there's a couple specific things that we check too. So when we're doing the thermography, we also do temperature checks of Atlas to make sure that Atlas is not subluxated before and after, when we're checking
Yeah, we have like good checks to make sure like we corrected that subluxation, we corrected that misalignment, we know like baby is good to go.
Yeah, and that we measure every single time baby
Yeah.
comes in, and we've seen great results since we started taking those Alice Fossa temperatures. So.
Yeah, and I just had a baby in a day. They've probably been in, I don't know, quite a few times. And then like mom was going back to work, hadn't seen baby. It'd been maybe 3 weeks since baby was in, and they were back, and they're like, okay, like because like subluxation till the pattern, your body remembers that pattern, right? It's gonna like stay with it unless it's corrected and relearns it.
It'll return to that in times of stress. It's a survival.
Yeah, mom going back to work, that's a pretty stressful time for that baby, right?
Mm-hmm.
So issues were showing back up. Today she was way out, needed to be adjusted. Because that's always another thing we get, like, how often do I have to come? Like, how long is this gonna take?
Yeah.
I hear you go to a chiropractor. You always have to go to a chiropractor.
Healing takes time.
Healing takes time.
Yeah. So does neuroplasticity.
Changing those patterns, it takes time.
It does. Yeah.
So if we stop in the middle of care, then
But you know what? It's a better fix. It's an actual fix. It's not just like covering up the symptom or putting a baby on antacids. You know what controls stomach acid is your brain telling your stomach how much acid you release to digest your food.
Yeah, so I don't know when spitting up got called acid reflux. I don't think it was always that.
Yeah, and I think they're characterized a little differently. So spitting up can just be like baby has a lot of air too, so they're like
so if latches off and all that, and they're getting too much air and too much gas while they're nursing.
Oh yeah, we should talk about. Okay, so this is another thing with latching. If baby's taking in a lot of air and they have a lot of gas, they're super burpy, super uncomfortable after nursing, and they're just doing the spitting up and not the like digested milk acid reflux thing. That could be a cranial bone misalignment. So we see a lot of like high palates with sphenoid, and so we'll do some cranial bone adjustments too, again super gentle with infants. But sometimes that sphenoid bone gets stuck when they're in the birth process, and that means it's not like their palate is high, so then they're just sucking in a bunch of air. That was that baby that wasn't sleeping, too. That they were seeing a lot of that once we started doing some cranial work. She was like so much happier, and she's been doing really good ever since too.
The babies,
all the babies,
the babies. So that's that happy parents. So yeah, a lot of that. We talk about ear infections. Maybe we'll talk about ear infections next time. You know what? We have not seen a lot of ear infections right now. Spring is coming.
Yeah. So we're seeing a lot of allergies kicking up right now. That is a great time to get adjusted. Get some cranial work.
Get that immune system boosted.
Yeah. And then
we have a great supplement for allergies for kiddos, and it also like help with the process as you're going through.
I bet you we'll start seeing some ear infections once allergies.
So we'll talk about that. You'll see us in like a month being like, we're seeing a lot of ear infections, and we warned you.
This is what's going on now. We called it a month ago.
Ear infection kiddos, like it's hard when you got them on antibiotics. It's going to create gut issues later on. Antibiotics. Oh, chops. Like that's a surgery for a kid. No one wants a kid
and
surgery.
then
It's
we
scary.
have autoimmune issues and allergies and asthma. And
so we can talk about the anatomy of the ear next week.
Okay, let's do that.
If we remember. Who knows what we'll actually talk. Oh, actually, no, we're having a guest speaker, I think, next week, maybe.
Okay, yeah, we'll talk about postpartum depletion next week.
Yeah.
So stay tuned.
Stay tuned, but don't forget, we have our March Madness tournament
It is
happening.
the Ides of March, so we are doing March Madness.
I have been waiting to do this since last year. I love March Madness.
Brackets need to be in tomorrow.
Okay, I'm going to say tomorrow to be safe, but other people have been telling me not. Games usually start on Thursday, but this year I think they're starting on Friday. So you might have Friday till 11, but like be safe, just get them in tomorrow.
Yeah. Just do it. Nike, just do it.
Just do it. They've got that great ad out about pregnant.
I saw that. Oh, so good. We should share that on our stories.
Anyways, okay, so we have our March Madness bracket. Can we put the link below this? And so if you are a patient of ours, join our group. It will have the link there. There's a password to it.
Rise Wellness.
The group is Rise Wellness.
Yeah.
But the link should go right to it. If you need a password. So if you didn't get it in our email for some reason, if you just deleted our email or decided not to be part of our emails, you should because they're pretty good.
Yeah. They're as funny as these.
We only send out one a month. We're not, but the password's in there. But if you want to do it and you don't have our email, you lost whatever, message us. We'll send you the password.
Yeah, just direct message.
And then there's also like different ways you can get extra points. We can talk about later as the tournament goes on. I don't even remember what they are. So also I know nothing about basketball right now. I used to know more. I went to Michigan State. Love Michigan State. They're horrible this year. So
Don't
So-
take that as a bracket tip.
So I don't know.
Out for
So don't
sure.
worry. None of us knows. A lot of us are just moms and ladies doing it. So whatever.
Yeah.
Just do it.
Also,
it's
they
free.
have the standings like on there. That's kind of how I
You
went
didn't
on
know
the
that?
bracket.
This is
I
your first
know
bracket.
this- No, you know what I did it last year when we had to when they canceled March Madness.
Okay.
This is
Annie knows nothing. She'll probably be the best.
Basketball is not my favorite sport.
So we're giving out lots of great prizes for the top 4.
Mm-hmm.
A zoo membership, family zoo membership.
Yep.
Family membership to Frederick Meyer Gardens. These are like all my favorite things.
Mm-hmm.
An hour and a half massage.
Yep.
And then a $100 gift card to the restaurant of your choice. I say we make it like a local Grand Rapids restaurant.
Oh, yeah,
Sure.
sure.
Yeah,
Yeah.
yep. It has to be that. You can't choose McDonald's.
No, we're supporting local.
We're supporting local.
Who wants
And
$100 to McDonald's too? That's
I mean, I'm thinking like $100 to like a coffee
Outside.
shop. No. Okay, like, you know what I mean? Like a place you can use your bagels.
Yes.
You can use
Oh
it
my
over
God.
and over again.
Eat there for a
You
year.
know, that's not a bad idea. But
you want
you get to pick. We'll let you
Yeah.
like pick. Whoever wins top can pick which one.
Maybe
We'll
we'll
order
order
up.
some recommendations, but
But I mean, like for like which ones you win.
Yeah.
Because maybe you don't want the zoo membership. We're not gonna make.
no,
That'd be the number
exactly.
one
You get
prize.
to choose. Yeah.
And I hope I win because I want all those things. And I'll buy it for myself through the office. All right. So good luck,
It's
everybody.
rigged. The brackets are rigged. We're the only ones playing. Please do a bracket.
Please do it. It's fun. I'm
We
printing
wanna
them
get
out.
these
I'm pretty
prizes
sure I'm
back.
gonna print them out and paste them around the office.
Oh, that's a good idea.
And I'm gonna keep track and mark people off where they're at in the bracket. So I'm not actually working anymore. I'm only doing bracket.
I'll be working, so I'll see everybody the rest of March. When does March Madness end?
I don't know, April sometime.
It's really March.
It's usually like
April
spring
Madness.
break time, I think. It's the
Spring
tournament.
Madness.
Other tip. Okay, sorry, this became a basketball tip. Sorry. My last one. A patient told me yesterday that because of COVID, if a team like gets COVID, they're just out of the tournament. So if you had that team, they're a really good team that was supposed to be going all the way. I don't know if that's true or not.
First round.
Look it up.
Yeah.
Google that stuff. But I was like, dang.
Yeah.
You can't even like that's what it's really up in the air this year.
Oh my God.
Anyone can win.
It's
the
COVID
bracket.
rules.
COVID.
It could be anyone.
Yeah, it could be anyone.
Yeah.
All right.
Oh my gosh.
Okay. I hope what you got from this
Penn State.
is that we can help
I
with
don't know.
acid reflux.
I was just naming the first school that came to my head. All right.
All right.
Yeah.
We'll see you next Wednesday.
With a guest, a special,
Hopeful.
secret guest. Did
secret
we say her
special
name?
guest.
I don't know.
No. Well, you know, if it actually works out, but hopefully we'll have
Yeah.
someone here.
Either
too.
way, we'll.
So you don't have to just listen to us anymore.
Yeah.
Okay. All right. Have a great week. Happy St. Patty's Day.
Bye, guys.
Bye.